How are you?
Fine, thank you.
We are Heidi Rojas and
Sandra Giraldo. Okay.
We are the nurses and we are looking for Mr. Cabrera.
Okay, good. Go ahead.
Hi, how are you?
Good.
Thank you for visiting. My name is Jesus.
Hi, how are you?
I'm Mr. Cabrera's son. Thank you for coming.
Nice to meet you.
Hi, Mr.
My
Cabrera.
wife that she
Hi,
Good
nice
evening,
meeting you.
Laura.
Nice to meet you. We are here because you request our visit to review the booklet that was given yesterday about the medication you're taking. As you know, you were diagnosed with atrial fibrillation, and a medication called warfarin was prescribed to you.
Okay, thank you for visiting. Have a seat, please. Have a seat.
Thank you for visiting.
Have a
Thank
seat.
you.
I'm really glad that you guys are here because we'll have a few questions that and we wanted to ask you, and we hope that you guys might be able to answer them. It's regarding the medication.
Of course, we're going to try to answer the question as the best of our knowledge. And I know you have an educational section yesterday with the health educator at the hospital.
Oh, yes.
And you called us this morning because you needed an extra education from
Yes,
us.
it's correct.
So we are trying to answer all your questions. Just please give us the concern that you have. And Heidi and I, we are going to try to answer all of your concerns.
And if we don't know about your question, we will more than welcome to call your healthcare provider.
Okay, yes, I am worried. I want to ask you to explain to my relative is something about my medication because really I was so anxious when I was taken out of the hospital, my discharge. I don't put more attention, you know, and I need some clarification about because I don't understand really. I am worried about, I am scared for this medication.
Okay, Mr. Cabrera, let me explain to you how your medication works. As your discharge yesterday in the hospital, you received a booklet like this.
Oh yes.
And in here said that your liver made clotting factor that help your blood clot and prevent bleeding. However, some blood clot cause serious medical problem.
Okay.
Warfarin, that is the medication you're taking, block that formation of the clot. What I want you to remember is that your medication prevents the blood clots.
Okay. Oh, I know. I understand. The warfarin is a blood thinner, and it prevents that my blood form clots.
Yes, you're
Okay.
right.
Can I ask you a question?
Sure.
Okay. How much Coumadin should my father-in-law take?
Oh, that's a very good question.
Yes, I will.
And you know, Mr. Cabrera, yesterday they prescribed you warfarin, 2 milligrams.
Yes.
And your doctor told you that you need to take 2 milligrams every day and the same medication at the same time. This is the most important thing. But every
The
so
same
often,
day and
that's
the
the
same
same
time.
day and the same
Okay.
time. But remember, every time you're going to visit your doctor, he's gonna give you a lab. And you're gonna take a lab, so then they might adjust your doses every time you're going to see the doctor. So remember, if they change the doses, you're gonna take the same doses at the same time. That's the main idea that I want you to capture.
Actually, yesterday the nurse mentioned something about a blood test that my father needs in order to keep the medication at appropriate level. So I don't know. We don't know exactly what type of blood test is that. Can you please tell us some information about that blood test and what is it used for?
Sure. That blood test you're talking about is called PT-INR. It's used to see how quickly his blood clot and if he's taking the right amount of the medication. It's only a small amount of blood that is taken that day of the test.
Okay.
Mr. Cabrera, when you have the blood test scheduled, be sure to go the same day and the same time that you are scheduled.
Okay.
Be sure to go to the same lab each time because the result of your PT can vary between one lab to another one.
Okay, I have to go to the same lab, the same day, and the same time. I have to go to my schedule and cannot miss it. And what is another point?
And that day, you're gonna call your healthcare provider to see what amount of the warfarin you're gonna take that day.
Okay, okay. I have to call my health care provider to know how quantity of warfarin I have to take.
Yes.
Okay. Okay, I have another question. I am worried about, there are another things that can change my blood test results. There are another things that can change it.
Oh yes, Mr. Cabrera. Here in your booklet, you can read here that many over-the-counter or prescription drugs, vitamins, and herbal supplements, and certain foods. Look this list. So review this list, and every time you eat something from this list, it's gonna change your PT-INR lab result. So make sure that you avoid this medication or this type of foods, so you are gonna be safe.
Is anything else would you like to review, or any other question do you have?
Sure. Yeah. Actually, yesterday the nurse educator spoke about some safety issues. Now you have some concerns about that.
Yes, I have a concern. I am worried, Heidi. Heidi is your name, no? Yeah.
Yes.
I have a concern. What happens if I cut myself when I'm shaving, for example? I am worried about.
Mr. Cabrera, that's a good concern. If you have a small cut, just make a pressure in the cut for about 10 minutes. That will stop your blood. But if you have a large cut, seek for medical attention immediately.
Okay, I will that.
Okay, Dad. If you have no more questions, I don't know. We just wanted to thank you for visiting today and for providing us with all this valuable information. We already have the brochure here, and if we have any question, we will call you. We will contact our healthcare provider again. Okay. Thank you one more time for coming today.
Well, thank you for receiving us.
Thank you. Thank you very much.
Bye-bye.
Bye.
Bye-bye. Bye.
Thank you.
Nice to meet you. Thank you
Thank
very
you
much.
very much.
Thank you very much.
Same here.
Bye.
Thank you for coming today.
Thank
I'll
you.
walk you through the door.